Hey guys, welcome back to my YouTube channel. My name is Tora for those who don't know, and today I will be happily talking about pharmacology and how I made pharmacology easy for me throughout this semester. So, in pharmacology, obviously we know it's all medication related. So we will be going over, let's say, the respiratory system. So we'll be doing all medications that need to be done for a week with the respiratory system. And then like cardiovascular disease, we'll work on medications for the cardiovascular. Okay. So we were handed out these medication templates, and on these medication templates are the action, the therapeutic use of these drugs, complications, contraindications slash precautions, nurse and intervention, patient education, administration, the evaluation of effectiveness of the drugs. Okay, all this is on this little old template. Okay, this paper here. So I did my template, of course, and that probably helped me out more. But I have a little secret on what really helped me study, and I can go anywhere with this technique. I can be walking through the mall looking at this little flashcard. Flashcard, that's right, I said it. Flashcards. Flashcards got me through pharmacology. And not only flashcards, the way I set up my flashcards, okay? So on this template, you see all this information scrambled in there. Small little, what, I say like 10 font. All right, so on my flashcards, what I did, so say as though we were working on a cardiovascular system, okay? I will just do the classification of the medication. So cardiovascular, let's say beta blockers, okay? So I'll use beta blocker as my class, and then I'll only do 3 drugs for beta blockers. 3 commonly used drugs, the generic names. So beta blockers, metoprolol, acylbuterol, propranolol. I'll use 3. Those commonly used drugs, okay? And then I'll list the action, the contraindications, the interaction, adverse effect, nurse and evaluation, administration. And basically, I know you're probably like, okay, well, doesn't each medication have their own action and contraindication? No, they're all under the same class, so the action will be the same. The contraindications will most likely be the same, the interaction, adverse, and so on and so forth. It helped me, telling you. All right, so we know the action is what the medication is doing in your body, okay? We wanted to stimulate certain receptors, ion channels, and act on enzymes for the action, right? So we'll just write the brief action. And then the contraindication, okay? So what worsens this drug? Who can't we give this drug to? What contraindicates with this drug? So one contraindication that I can think of, some pregnant women cannot take certain medications. So that's a contraindication. Why can't we give this medication to a pregnant woman? Birth defects, okay? Interactions. Interactions are basically other medications interfering with the way the medication is working. It can decrease the absorption, increase metabolism, increase adverse effect, while you decrease in the effectiveness of the drug. Okay, that's where interaction goes in. Adverse effects. Adverse effects and side effects, they kind of go hand to hand sometimes. But how you defer the two is adverse effect is something that you absolutely do not want to happen, whatsoever. It's life-threatening. It's critical to the patient. You have to call the physician as soon as possible. The patient is basically on their deathbed. Sorry to say. It works in the total opposite way of what the medication was supposed to do for the patient, okay? And side effects are common, like headaches, drowsiness, dizziness, nausea, vomiting. Those are side effects that you see with probably, I'll say 90% of medications out there, okay? And administration. How are you going to give your treatment to your patient, okay? Are you giving it orally? Are you giving it IV, intravenous? Are you giving an injection, an IM injection? Is it a transdermal patch? How are you going to administer this medication to your patient? okay? And then your nursing evaluation. When you give the medication, you administer the medication, you want to go back and make sure that the medication is working for your patient and your patient's body is reacting to that medication well, okay? So if you give a beta blocker, you want to go back and make sure that the patient's blood pressure is decreased. There's a decrease in the heart rate from tachycardia. You just want to make sure that you want to evaluate the effectiveness of the drug, okay? And then we go down to patient education. Okay, so you're teaching the patient how the drug works, why are they on it, how long will the therapy last, okay? But when you are teaching, you also want your patient to teach back to you, so for their understanding. So you want to be clear that they understand what you are teaching, okay? So you'll teach and have them teach back, all right? So this is like a brief way on how I did my med cards. It got me through. I'm done with pharmacology, B+. Ended pharm with a B+. I could actually did better too, but I'll take that B+. And I'll run with it. But anyways, so these pharm cards, they work. These templates, it's like, come on. Who really wants to study from this long thing? You could cram all this information, all the important highlights on your med cards. Use the class. I stress that you only do class and pick at least 3 commonly used generic names for each class, okay? So don't go writing flashcards with all these different meds. Why do a med on metoprolol? Why do a med on propanolol? Like, they're all in the same classification, so they're all going to have the same action, okay? So when you do your med cards, just do the class, pick 3 generic names, and then fill it out with the action, the contraindication, interaction, and so on, okay? It really helped me, and I know that it can help you, so please try it. And also, before I close this, I wanted to let you know that sometimes this week, I will be uploading a video on how I understood the medications by their class. So, beta blockers, how I said earlier. How I learned what beta blockers do and how it stuck with me up here. So beta blockers, you know that all beta blockers end with LOL. So I did like this little song, LOL, I'm laughing that I'm blocking hypertension from you. And you are no longer tacky. So LOL, I'm blocking hypertension and you being tachycardia. Okay, so that's how I stuck with beta blockers. They decrease hypertension and tachycardia. They treat MIs and so on and so forth. Okay, so I will be uploading more videos on that, how to learn your medications, different songs, and different little sentences that you can use to help you understand the medication and help it stick when you see the little LOLs, the prils and ACE inhibitors and, all that, okay? So have a look out. Subscribe to my channel. Please subscribe. Comment below anything that I may not have went over that you were looking forward to seeing. And any other videos that you can think of that can help you. I am totally down to post every week. I'm trying to make that my goal every week posting. So the end of this week I will be posting on how to remember your drugs, with different little songs, okay? So just keep on the lookout. Subscribe to my channel. Don't forget to subscribe. Please subscribe, okay? And I will see you next time. Thank you so much. Bye.